Hi, Dr. Campbell. World Salt Week is coming up, and can you tell us a bit about it?
This is a week that was really developed to increase awareness in the general public about the dangers of high salt and how to reduce dietary salt. It was created by a group called WASH, or World Action on Salt and Health.
Great. Why is salt reduction important to people?
Reducing dietary salt is one of the most important ways to improve health. As dietary salt increases, blood pressure tends to increase. Increased blood pressure is now estimated to be the leading risk for death and disability in the world by the World Health Organization. In addition, high dietary salt is associated as a probable procarcinogen for stomach cancer, one of the more common forms of cancer, and has been associated with kidney stones, asthma, and osteoporosis.
What are the opportunities here in Canada that we have to improve the situation?
There are several different opportunities. Right now there's a bill before Parliament that would introduce an effective strategy to reduce dietary sodium in Canada. Most of the health and scientific organizations are strongly committed and have signed off on policy statements and written letters of concern to our government, including our Prime Minister, that we need an effective program. The premiers of our provinces and territories and health ministers have written and supported the need for sodium reduction. And when we poll Canadians believe this is an important topic and are quite supportive of strong government action, including regulations such as warning labels on foods to reduce dietary sodium.
What do you see some of the challenges that we face?
There are still very substantive challenges in Canada. Right now we don't have an effective program. It's based on industry voluntarism without any monitoring, so we don't even know if sodium's being effectively reduced in foods. We still have a lot of misleading information coming out of the food sector and the salt sector around this. And so there's still lots of work to be done.
Why are you optimistic about the prospects of improving people's health through dietary salt reduction?
Well, I'm optimistic because there is an awful lot of momentum behind this. One of a very few number of recommendations coming out of the United Nations to prevent chronic disease is to reduce dietary sodium. Reducing dietary sodium is called a best buy by the World Health Organization, recognizing not just that it improves health, but it saves government money. We have our health and scientific sector in Canada strongly lined up behind this. We have an awful lot of public support for this. In the end, this is really about the benefit to Canadians versus the profits of a very few individuals in the food sector and salt sector.
Great. Well, thank you for your time.
You're welcome.